How is bipolar disorder diagnosed? People don't always understand what bipolar disorder is or how you get a diagnosis. Bipolar is often associated with mood swings or even just as an adjective to mean something that is changeable, but I think both of those are really unhelpful in understanding the condition. People with bipolar disorder have periods of time where they experience mania and periods of time where they experience depression. Everyone has their own unique experience of both, but during a manic episode, it's common for people to feel an intense sense of happiness or excitement. They might talk really fast and not sleep much, if at all. People's perceptions often change during a manic episode too. They might have larger-than-life beliefs, like thinking that they're a member of the royal family or an important superhero, and they might assess risk differently and do dangerous things that they wouldn't otherwise try. For people with bipolar disorder, an episode of mania is then followed by a significant period of feeling low. People often have a lot of guilt and regret about what they've done or forget what they've done while they were manic, and that can be really difficult to deal with. It's normal for everyone to experience mood swings, especially young people who are having to deal with change in pretty much every area of their lives. But bipolar disorder involves experiences that are much more than feeling happy or feeling sad. These episodes tend to last for longer periods than everyday emotions, and they often change without an easily identifiable trigger. If you read about bipolar disorder online, you might see information about different types, but often we don't talk about bipolar like that in the UK. The only type you might really hear people talking about is rapid cycling bipolar, where the period of time between each episode of mania and depression is shorter than the typical bipolar experience. Young people aged 18 and under can be diagnosed with bipolar disorder, but it is fairly rare. You usually need to have experienced both mania and depression to be diagnosed, which can take a while. It's also less common than other conditions too. You might also be given what's called a working diagnosis. We know that it's important to get the diagnosis right, and working diagnoses allow us to offer people help and support as soon as possible, including before we have enough evidence to give someone a definitive diagnosis. Lots of clinicians, including GPs and mental health nurses, can support people with bipolar disorder, but only a psychiatrist, a medically qualified doctor who's specialist in mental health, can actually give someone a diagnosis. Psychiatrists work in the community as well as in hospital settings. Another bigger misconception about bipolar disorder is that it always leads to people being hospitalised. We can't diagnose someone with bipolar disorder based on any kind of blood test or scan, but it's common for people with symptoms of severe mental illness to have blood tests, so we can rule out physical health conditions that cause similar symptoms. You'll also find that you're usually asked about drug and alcohol consumption. This is because certain drugs can mimic symptoms of mental health conditions like bipolar disorder. You're not asked about drugs to get you into trouble, it's about making sure you don't get given the wrong diagnosis or medication. In terms of assessing someone for bipolar disorder, once physical health conditions and drug-induced experiences have been ruled out, doctors refer to diagnostic criteria, specific guidelines about the signs and symptoms that mean someone may have bipolar disorder, rather than any other mental health condition. Their assessment might involve a range of things to learn about your mood, your experiences, and whether you might be a risk to yourself, a risk to other people, or at risk from other people. You might be asked to fill out some questionnaires, and they might talk to you and see what your behaviour is like. They might also ask your parents or your carers how things have been at school and how you are at home at the moment. It can be difficult and frustrating to not have any simple way of telling whether you or someone you know is experiencing bipolar disorder, and not to know exactly what to expect from an assessment. The exact process of diagnosis will be different for everyone because it will depend on your situation and the person or people helping you to understand what's going on. I think it's really important to say that people who are diagnosed with bipolar disorder can go on to lead really good lives. Lots of successful and famous people have spoken out about having bipolar disorder, including award-winning actors, musicians, sports people, politicians, and business people. You might have to adjust certain habits in your life, and you might need to take medication and engage with mental health nurses or therapists. But with a strong support network, it is possible to manage bipolar disorder day to day and do the things that are important to you. If you are worried about any of your mood or other symptoms of bipolar disorder, a good place to start is to make an appointment with your GP, who can help you get the right support. For more information, including how to get urgent help or how to stay well if you have bipolar disorder, check out the Best For You website.